Hi, I'm Jon Roffman, Managing Principal of ZS's Oncology Vertical. I'm here at ASCO 2019 with Dr. Julie Vose. Dr. Vose is the head of hematology and oncology at University of Nebraska Medical Center. She also served as a former ASCO president, as well as on the FDA's Biologics Committee and ODAC. With some therapeutic classes, for example, with some of the immunotherapies, PD-1, PD-L1 therapies, uh, we're seeing, and also with CAR T, we're seeing a number of therapies being developed that are all targeting sort of the same mechanism of action. And so as we see that with clinical trials, how does that change the bar for evidence that the FDA might be looking for?
Right. So I can't really speak for the FDA, of course, but from the physician standpoint, we're looking for things that have some sort of improvement in the baseline. So they need to be more efficacious, less toxic, in the end maybe less expensive for the patient because of financial toxicity. There has to be some improvement over the original, or it's hard to make that justification to do a Me Too drug anymore, I think.
There was just an article I read last week that suggested that there's over 1,000 cell therapies in development, and I think over half of them targeting CD19.
Yeah.
So obviously there's a ton of companies and therapies going after the same target. How do you see that playing out? Is that sustainable?
Yeah, I don't think it is sustainable. There's too many targeting CD19. There's only, you can only use that once or twice in a patient, and then that option is gone, and they often relapse with a CD19 negative relapse. So I don't think that that's really, from a business standpoint, sustainable to have so many different ones targeting that same CD19. There's many other targets that could be targeted. There's bispecific CARs, potentially. There's loaded CARs. There's all kinds of different ones going on. So I think they'll sort out in the end, but there's just so many. It's probably not sustainable for all of them.
What are you most excited about in the cell and gene therapy space?
Yeah. I think probably the CAR Ts that are bifunctional, hit two targets, or that are loaded with another agent or something are going to be the ones that are the most interesting. And the ones that have combination therapy with trying to prolong the effect as long as possible with checkpoint inhibitors or other agents to try to prolong that modality as long as possible. Also, the ones that are not specifically manufactured from the patient, but that are more generic, I think will be also ones that will be easier to use in the future.
The off-the-shelf.
Off-the-shelf CAR Ts, yeah.